Thank you so much for spending a few minutes with us to learn about what's going on in our community as it pertains to the pandemic and at FHN. For this video, I'm pleased to be able to be joined by Wendy McGath, who is one of our mental health experts who works diligently at our Family Counseling Center. And she's going to talk a little bit about pandemic fatigue, something that most of us can relate to. So I'm very grateful for Wendy taking some time out of her very busy schedule to be able to share with all of you. Thank you, Wendy.
It's my pleasure. That's a good question. I imagine it's really difficult for some people who haven't been able to see family members or friends, or who may have underlying health conditions or go out to eat or go on vacations. It's probably really difficult after a year to avoid that, especially now that we're hearing the numbers are going down. But there's still variants out there of the virus that they haven't they're not entirely sure about, and then not enough people have been vaccinated, and there's just not enough numbers out there to really support just opening everything up. So using an approach where you kind of follow CDC guidelines just for a bit longer until we are really pretty sure that things are going to be safe. I think the biggest encouragement for folks is just, reinforcing the idea that this will end. The vaccinations appear to be working very well. More people are getting vaccinated. It is very fatiguing. We're all tired of doing this, but even if you've been vaccinated, modeling for other folks, kind of that team spirit that we're still in this together, even though we're vaccinated and we may not get sick or pass away ourselves, we're still going to wear masks, we're still going to socially distance, we're still going to try and protect those that are most vulnerable. So some of the things that the CDC has recently talked about are good things to do. Is if you've been vaccinated, you can gather in small groups of vaccinated and unvaccinated people with low risk to passing the virus on to others. You can go out to eat with other vaccinated people. You can do outside activities, outside sports, as long as you're in a small group with vaccinated folks. If you haven't been vaccinated, you should probably continue to just meet with your friends who've been vaccinated, or your immediate family members who live in your household. Big events like sporting events, concerts, things like that where there's lots of crowds, probably should still wear a mask. That's what the CDC recommends. But for other outside activities, and outside activities, even if you're unvaccinated, if you practice social distancing or wear a mask when you're around other folks, you're probably safe to do those things as well, and the weather's getting a lot nicer. So really good to get out. That does a lot for your mental health. The sunshine, being out, seeing things bloom again is a very good way to improve your mental health. That's a great question, and it's really multifaceted. There's a couple of different things that are playing into people's anxiety over getting back to normal. First of these is prior to the pandemic. You had your extroverts that were out doing a lot of things, introverts that stayed at home, and the introverts sort of functioned in that extroverted world, and then it sort of flipped on its head, and all of a sudden the introverted people are like, this is great, I have no problem with this, while extroverted people are being forced to live that introverted sort of lifestyle, and that becomes very difficult because those introverts became very comfortable and probably increased some social isolation, which isn't healthy for anyone. We're, by nature, human beings are pack animals, and we need a pack. We need to be around other people. And so, while extroverts are raring to go and get out there and be around people again, those introverts that may have avoided things in the past got really comfortable continuing to avoid things during the pandemic. So getting those people out, getting them to be not so socially isolated is difficult. The other part of it is a concept that is called human irrationality about risk. So, an example would be that people focus on like airplane crashes, even though they rarely happen and they kill very few people, or they kill a lot of people but don't overall kill people. They're rare incidents. Yet car crashes happen every day. Approximately 100 people a day die from car accidents. So right now, if you've been vaccinated and you're still nervous about going out, the problem is that this is a salient risk. This is a risk that's very recent, it's very new, we don't understand it as much. So even though people still go out and get in their cars, the risk to them of being in a fatal car accident in any given day is about 100 people a day in the United States die from car accidents. 0 people will probably die today who've been vaccinated from COVID. 0 to maybe 1. And so the risk is much higher with car accident, but it's a risk that we've all become used to. We live with it every day. We've lived it every day of our lives. But that salient risk of this COVID, this unknown variable, continues to make people nervous. And the only thing that's really probably going to affect that is just kind of baby steps, stepping out into small activities, and then you experience, okay, nothing happened. I survived this. I had dinner with my friend out at a restaurant. Everything went fine. So little by little, as you start stepping back out and start feeling more confident in the efficacy of the vaccines and more people getting vaccinated, you'll feel more comfortable getting back out into life. But for those introverts that have gotten really too comfortable, maybe some of their extroverted friends can kind of pull them out a little bit, especially when you've both been vaccinated. So like I said before, doing small activities initially, kind of those baby steps, meeting with just a friend, going out to eat in non-busy times. Also reframing your thoughts. A lot of times we tend to think our brains are kind of in tune. It's a survival mechanism to weigh risk initially. If I go out, well, what are all the bad things that could happen? Instead, reframe that in, I'm now safe. Even if I got COVID with this vaccine, I'm very, very, very unlikely to die from it or to even require hospitalization. I will be safe. So reframing those thoughts to be more positive. And also, if you find yourself just unable to get past this, seek out a therapist. A good therapist will help you with reframing some of those thoughts and managing that anxiety. People often have different and unknown reasons as to why they don't believe in vaccines or why they refuse to wear masks, and sometimes, sometimes I tell some of my patients, you just have to sometimes let people be wrong. People have they've come from different walks in life, different experiences, and so you really can only control yourself. And if you're out in a situation and somebody doesn't have a mask, you have the right to walk down a different. I know at a grocery store, if I see someone without a mask, I just walk down a different aisle, or kind of just let them kind of be in their space and just stay out of their space. You can also, and if you're in like a family setting where it's a little trickier and you want to maintain those relationships, just very politely say, I'm practicing social distancing. Could you please back up just a little bit, or just move to another area? Kind of using kindness typically goes a long way. And finally, the last thing is be firm but non-confrontational. Using I feel statements, I feel uncomfortable with this situation, or that goes a long way. You're not pointing the finger at somebody else, telling them that they're wrong or they're a bad person. It's just you're talking about your own comfort level. People are more likely to have respect for that approach. Teenagers, a lot of times we don't give them a lot of credit. They're pretty savvy about what's new in the news and things like that, so being really honest and upfront with them. Certainly don't lie to them, certainly don't gloss things over. That's just not respectful to a person who's learning to be an adult. But modeling what you want to see in your kids is always a good approach. If you want your kids to wear masks, if you want your kids to socially distance, if you want your kids to take this virus seriously, then you should probably do that yourself. And for young children, little children are very resilient. You don't have to scare them with things. I have a 3-year-old granddaughter. She has no problem wearing a mask. We started a year ago when she was 2 years old. She just knows that when she goes into a store, she's got to put a mask on. She leaves it on. She sees us modeling that behavior. So it just doesn't really impact her at all. It's her normal. And that's a lot of times with small children. I've got a few who I see for therapy who are like 8 to 10 years old, and they are very willing to wear masks and to socially distance. They have no problem with it once they find out that's sort of the rule, and that other adults around them are modeling that behavior. They're willing to do that as well. The biggest one is get vaccinated. It's a safe vaccine. My son is a doctor, and when he got it, he was one of the first people in Illinois to get it. And when he told me to get it, I'm like, well, he's probably not going to tell his mom to get something that's unsafe. So get vaccinated, certainly if you have the opportunity, and get outside, enjoy the weather. It's been a long winter, it's been a long year, and things are starting to loosen up a little bit. I've heard from epidemiologists that if things continued on this path, things might open up even more by the third quarter of this year, which I believe is August. And so get out and enjoy the beautiful weather. And spring is a time of this kind of rebirth. It's all around you, and it does a lot to enhance your mood. Enjoy the activities that you can enjoy with others, vaccinated or unvaccinated, following the CDC guidelines. And remember, above all, this will pass. We've had pandemics in the past. Most of us probably weren't around to remember them, but we have had them, we have survived them, and we will survive this one.
At FHN, we've been fairly stable as far as the amount of patients that we've been seeing. At the time of this recording, we have 9 positive inpatients for COVID-19 that are in the hospital. Thankfully, none of them are on a ventilator, although in the past few weeks we have had still positive patients that have been on a ventilator. It's something that's a good reminder that COVID-19 is still with us. There could be a number of different reasons why that appears to be happening the way it is. One of the things that may be a good news aspect of that is many of our older population are being vaccinated, so they're being vaccinated and staying out of the hospital, which means that the people that are being admitted to the hospital are the unvaccinated or the younger individuals. There could be some concerns about how more contagious or how much more contagious some of the new variants are as well. And we're also seeing more contact and people being less cautious, and I think that's driving up some of those numbers as we're seeing in the past few weeks. Unfortunately, we've always seen younger people being hospitalized. It just didn't seem to grab as much attention early on because of the level of significance for the older population. But even in 2020, a good portion of the patients that were coming into the hospital were in that younger generation. We're not talking about children, but we're talking about adults, people in their 40s, and within that age frame, we have seen them. Certainly those with chronic conditions have contributed to that, where age doesn't seem to be so much of a factor as overall health seems to be. And currently we are still seeing, again, people of all ages. We're doing a good job. We have a great start to vaccination. We certainly have much more people to go ahead and to get vaccinated. I believe the last statistic that I received from the Stephenson County Health Department for our general area is that we're probably over 70% for those that are over age 65. One of the things that's challenging with those vaccination rates is we're only able to capture the people that are recorded in eye care for the state of Illinois. So that means people that have received vaccinations in Iowa, Wisconsin, or even Florida aren't necessarily being accounted for in those numbers. So the ones that are reported through the state may be actually a little lower than the reality that's out there. Overall, our general population was hovering around 26 to 27%. We absolutely are providing vaccinations to anybody who is interested, and I would encourage anybody interested to go to our website, www.fhn.org, and hit one of our links to go ahead and self-schedule for a vaccination. In the past few weeks, we've started to see people coming back into our doors, and that's a good sign that people are confident that we've been able to demonstrate that we can provide care for them safely, as well as a good sign that they're not putting off the much needed care that could be much more problematic down the road. So we are starting to see an increase in that, though we are still below the amount of patients that we normally would see as compared to 2018 and 2019. It's good to see that many people are taking advantage of having those joint replacements or those procedures that they need to have done with great outcomes here at FHN. Especially during this time of the year, it's one of those things that you really don't want to put off. It's a great time to be outdoors and being active, so making sure to take care of those is incredibly important. And again, those numbers are going up as far as the number of patients coming in and having procedures completed, so that's always a good thing. Well, FHN is still maintaining the rigid standards that we had early on in the pandemic. So we still have the same cleaning protocols. We're making sure that people are wearing their personal protective equipment, also known as PPE, such as masks and gloves and gowns. We're also screening patients that are coming into our facilities, as well as those that are having procedures done, because we want to make sure we identify and keep our patient population safe. Any patient that is positive for COVID-19, we have a special area of the hospital that we're able to keep them so that they're not mixing in with all other patients throughout the hospital. I believe it's a great time to get outdoors, be active, enjoy our beautiful Northwest Illinois, help to support a lot of our local businesses, get out and interact with people in a safe manner, and do continue to be cautious. We're not through this just yet, but there's good indications that we're making a lot of progress, and that's thanks to all of you. So on behalf of FHN, thank you. It continues to be a privilege to serve you.